Tuberculosis, TB, is an infectious disease and major health concern. Head and neck tuberculosis, HNTB, is relatively rare, but can arise in many regions, including the lymph nodes, larynx, oral cavity and pharynx. We retrospectively reviewed the clinical records of 60 patients diagnosed with HNTB in our department between March 2005 and January 2016. A review and summary of previous HNTB articles published in PubMed since 1885 was also performed. The subjects consisted of 17 males and 43 females, and the average age of patients was 45 plus minus 14.67 years. The major clinical presentation was a lump or swelling, followed by an oral ulcer and skin fistula. The most common site of tuberculosis was in the cervical lymph node. 3 patients also suffered from a malignant tumor in the head and neck region. A total of 980 papers involving 5,881 patients were included in our literature review. The included subjects ranged in age from 15 months to 100 years with a male-to-female ratio of 1.5 to 1. The larynx, 38.92%, cervical lymph nodes, 38.28%, and oral cavity, 9.92%, were the 3 most common development sites. 465 patients were positive according to a HIV test, and 40 patients had comorbidities with different types of tumors. Head and neck tuberculosis should always be considered during a differential diagnosis for lesions in the head and neck region. Early diagnosis and treatment can greatly enhance the therapeutic effect and patient's quality of life. Introduction. Tuberculosis, TB, remains one of the world's deadliest diseases and has surpassed AIDS as the leading cause of death due to infectious disease. 1. The incidence of TB decreased in the 1980s because of the development of the BCG vaccine, anti-TB chemotherapy and improvements in public health care. However, since 1985, the number of TB patients has gradually increased due to the increase of the global population and increasing amount of HIV-positive and multiple drug-resistant TB patients too. According to a World Health Organization (WHO) report, TB accounted for 10.4 million new cases and 1.8 million deaths worldwide. Indiana 20151. In addition to lung lesions, 1/5 of TB cases present as extrapulmonary lesions, among which the most common sites include the lymph nodes, peritoneum, ileocecal, hepatosplenic, genitourinary, central nervous system, and musculoskeletal regions 3,4,5. Diagnosis of TB in these organs is often overlooked because of its atypical clinical manifestations. However, extrapulmonary tuberculosis, EPTB, still contributes to a substantial TB incidence, and underdiagnosis of EPTB is also likely to cause lifelong sequelae and fatal complications. 6,7. Head and neck tuberculosis, HNTB, accounts for 10% of TB patients. 8. HNTB can affect most organs in the head and neck region, such as the lymph nodes, larynx, midlayer, oral cavity and pharynx. 9. In general, entrance of tuberculosis into these regions is covered with epithelium mucosa, therefore, immunosuppression or a break in this natural barrier caused by trauma, inflammation, poor oral hygiene or pre-existing lesions, such as leukoplakia, periapical granuloma, cysts and abscesses, could induce the occurrence of tuberculosis. 10,11. Because the early manifestation of HNTB is often similar to neoplasms or inflammation and because the systemic symptoms of tuberculosis may not be obvious, clinical consideration of HNTB usually occurs only after an ineffective anti-inflammatory treatment, biopsy, or even surgical resection. 2,12, 13, 14, 15, 16. Despite the large number of existing reports, the patient risk of medical injury and occupational exposure caused by a delayed diagnosis of HNTB does not seem to have decreased over the past decade. 17,18.